Welcome to the Tennessee Community Engaged Alliance Against COVID-19 Wellness Wednesday show, also known as TNCL Wellness Wednesday. I'm Dr. Katherine Y. Brown, your host. Today, it is with much excitement that I introduce you to our guest, Dr. Pamela Banks. Welcome to Wellness Wednesday.
Well, thank you for having me. I'm glad to be here, and good to see you again. And I'm just excited about the opportunity to talk about things that we can do to increase awareness about the need to being vaccinated, and all the things we can do to decrease the impact.
Absolutely. Now, because I know you and I've read your bio in preparation for today, I want to allow you to tell our viewers a little bit about your background and some of your many accomplishments.
Well, just a little bit about my background. Born and raised in Memphis, Tennessee, and that's where I got my start into community outreach at the University of Tennessee. So there for about 20 years, I love that place. For there for about 20 years, we were able to impact the community with things such as breast cancer awareness, anything that was going on in the community that needed to be addressed. We did a 401 on sex when Fraser High School had a number of African American young girls getting pregnant at one time. We brought all the kids there and addressed that, safe sex, and all the things they didn't know about sex. We have addressed things as far as domestic violence. So pretty much anything that the community needed, we tried our best to address it in a real way and allowed a safe place for people to talk about and discuss their needs. So there I was director of community affairs at the University of Tennessee. And then from there, I began to work with students and work with programs that made a realization of that young people can also be doctors too. So we used our students to go into the community with their white coats and to show African Americans and Brown and Latino young individuals that they could have a professional career and be able to sustain and move out of poverty by achieving these grades, these great achievements. So anything that we thought would increase the health and wellness of the community is what we did, and that's where I got my degree in.
Oh, I love it. So here's what our viewers know, that you are not new to community outreach and community engagement. And on that note, I want to take a quick pivot and ask you about your work with the COVID-19 vaccine in the community.
Well, yes, I was honored when Dr. Juarez called and asked me to be a part of this study. It was right after my daughter had a battle with COVID and almost didn't make it.
Mm-hmm.
She was in ICU and had a pulmonary embolism. And she's just 30. And so when he called, I didn't even ask a whole lot of details. I just knew that it was a initiative to, first of all, find out why there were so many barriers and what those barriers were to people being vaccinated, and also to address it and increase the vaccination rate, and also just to understand what the people needed and to diminish the impact of the COVID-19. Because of course, and probably most everybody knows now that African American community was hit very, very hard and still is being hit very hard. So to do anything, to speak about anything, to talk to anyone, to help with vaccination, to answer questions about vaccination, anything that we can do to help people mind be at ease about the vaccine. I told someone that I don't know a whole lot about the vaccine. I don't know a lot about the flu shot. I don't know a lot about a lot of stuff, but I do know COVID. I do know it will kill you. I do know it would have you on the phone 24 hours a day with your daughter FaceTime and praying that she doesn't lose her breath. And so I just try to encourage individuals to you're going to take a risk anyway. Take a risk with the vaccine because you're taking a much larger risk not being vaccinated. And so that's what this study does. It tries to understand and not to put pressure on anybody. And I don't mean to do that. And I'm not judging anybody who isn't vaccinated. But my role is to spread the word and to help people understand why it's important to be vaccinated, and to respect them if they choose not to, and tell them how they can be safe, how to, to wear masks and stay inside and things of that nature. So that's one role.
Exactly. And I'm glad that your daughter is okay. Let me say that. Very excited to hear that. And so as you think about this personal lens that you actually bring to the table, because A, you were already engaged in the community, but B, you were directly impacted, what is it that we should be telling our communities in terms of A, how to keep themselves healthy against the COVID-19 virus, and B, how to get vaccine ready?
A, to keep yourself healthy, I still wear a mask. It's hot. I don't like it, but I minimize the places that I go that I have to wear the mask. But we have to. I mean, it's just that's with anything. I remember my grandchildren didn't start getting a cold until they start going to daycare. So germs spread, and so just put your mask on. If you're going to be in a public place where there are other people, just put your mask on. Regardless, is my mom used to say, it's better safe than sorry, baby. And so that's one thing I would say. And then as far as getting vaccinated, you can pretty much go to probably any CVS. You can Google vaccination. And when I did it, because I moved to Maryland, when I did it, I Googled vaccination, and it automatically say your location. And it gives you a list of it. So if you can't remember all the things I'm saying, if you can remember to Google vaccination or vaccination ready, it'll tell you where you can get vaccinated. But it's usually any pharmacist, any Walgreens or CVS. It used to have a lot of places, but all the places that were available before are not as readily available. But you can still get it from a pharmacist. But then Google, because you never know what church may be doing it. And that's how you can find out how to get vaccinated.
So I want our viewers to really hear what you're saying is to research and educate yourself, and then look for the resources that are available in your community so that you can get the vaccine if you desire it, but also that you can continue to get education. I think that's really important.
It is.
And we think about someone with your background. I would love to hear your thoughts on what does community mean to you, specifically in the middle of a pandemic?
It's everything. It's everything. If never before, we should know now that everybody matters and everybody is essential. Everybody is important. I mean, this has touched across every lane. There's no one that hasn't been touched by it. So community is everything. And we build our community by sticking together and working together. And I'm responsible for everybody in my community. And I think before COVID, we had gotten a little, lax, my own little world and don't really matter. And now I notice everything. I notice, I notice homeless people more than I used to. It is very important that community stay together, and those that are have the resources, like community leaders, hospital partners, and universities, that they leverage their resources and work with people and educate them. And everybody doesn't have an internet, so in those cases, let's provide ways that they can still have the information without that, actually having that computer or that knowledge about a computer. But it means everything.
Everything. I love it. And you said something, I don't want our viewers to miss it. You said that everyone is essential. I think that's really powerful to hear, because everyone has a family or loved ones, someone who cares about their health and their wellness. So everyone matters. And so, I really do love the work that the TNCO and all these community partners are doing to make sure that we keep the community healthy and informed, especially during the COVID-19 pandemic. So let me tell you, I could stay on here with you all day long, because I love your thoughts, your perspective, but you have a lot of experience. You have been on the ground level doing the work. So Is there anything else that you would like to share for our viewers? Even if you want to share how they can get in touch with you, any upcoming events, what would you like to share?
Live. Do
Mm-hmm.
everything you can to live.
Mm,
Please take care of yourself. Take care of everyone in your reach that you're able to, and live. If you need to get in touch with me, you can email me at Pamela .banks@mmc.edu, and I can send you a list of available places in your area for the vaccine, and anything else you need to know about it. But I want us to all live and take care of our babies, those that are in school, and
yes,
it's such a sad day. So if you don't think about it for yourself, think about it for your baby in the future. We need everybody.
to live
We
for the
do.
future. You know, Dr. Banks, what is your why? I mean, I hear your passion. What is your why?
It's why we were here. I mean, it's like everything love. If I had to frame it up into one word, it's
Mhm.
love. We were created out of love, created to love, and because I do love, it matters to me whether you live.
I love it. I love it. On that note, what a powerful note to live and to love, and because you matter. You have heard it first from Dr. Pamela Banks on TNCO Wellness Wednesday. And for our viewers around the world, I invite you to join me back next Wednesday for TNCO Wellness Wednesdays. You won't want to miss an episode, and be sure to like and share this message. Until next time, stay informed, stay healthy, and share this message with your community. Have a great day.
Thank you.
Thank you.